Our article provides an overview of the use of social media in medicine and particularly in radiology.
My name is Alex Towbin. I'm the Associate Chair for Clinical Operations and Radiology Informatics at Cincinnati Children's Hospital.
Hi, my name is Saad. I'm a Pediatric Radiology Fellow here at Cincinnati Children's Hospital. It starts by kind of giving a background of the history of social media use for medical education.
And we talk about some of the different social media channels and how they differ. Platforms like Facebook, Twitter, Instagram, and our departmental blog.
The takeaway message of our article is that social media is an emerging technology which shows a lot of promise for medical education and particularly radiology. What we want to make sure our readers know is that you have to take the proper precautions to protect patient privacy while doing medical education, and we want you to be able to take advantage of the different nuances of separate social media platforms, knowing their advantages and disadvantages. But if you take all this into account, we think that social media is a great tool for medical education, and it can be used to reach larger audiences than any traditional avenue.
Yeah, I think that's one of the biggest messages of this article is that the barriers to social media entry are very low. It's generally free. It does take some time investment, but it's something that you can do easily and cheaply, and it can reach massive audiences. So if I'm giving a lecture at the largest medical conference, whether it's RSNA or a different societal meeting, at most I may be reaching 1,000 to 2,000 people in the room. With social media, we reach hundreds of thousands of people every day. And so that type of message, the number of people that we can reach is huge and amplifies the message and our ability to educate, to teach pediatric radiology, which is our interest, to a massive number of people. Not just within radiology, but outside of radiology.
We talk about the history of how it kind of began and everything surrounding the hashtag FOMED, which is Free Open Access Medical Education movement. And basically it's a movement where medical practitioners share their expertise publicly, and the point is to increase the general knowledge available to anyone and for free.
For example, we've had medical students reach out to us and tell us that our Instagram feed has helped them in the care for their patient. So when they saw a child who had swallowed a button battery, for example, they knew that the next step, that this was something dangerous, and the next step was to first get a radiograph to confirm that it was there, and then once it was proven to be there, that it needed to come out quickly. In the general day-to-day clinical practice for radiologists, it probably doesn't have much impact. But if done correctly, many of the social media channels can integrate into your day-to-day practice. For example, when I am reading cases every day, I'm looking for good cases that would be suitable for Instagram. I'm capturing them and obtaining some of the clinical data so I can write a case about it. I'm then able to batch create the cases so that they can be posted at a later date.
One of the goals of doing medical education, radiology education on social media in such a public manner is that we can share the knowledge that we've gained, working at an institution like Cincinnati Children's, which sees a lot of unique cases as well as bread and butter type cases, and we can share that expertise with other practitioners. We can share it with patients and their families, and this brings an increased level of awareness, increased level of general knowledge among people, and like Alex mentioned before, this can make an impact in clinical care and people knowing how to take care of certain conditions, or even knowing where to look for support. One example of that is we had posted a case of a certain condition, and someone posted a comment asking where they could go to look for support for their child in relation to that condition. And another Instagram user posted a comment saying that they also had a child with the same condition and they knew of a support group. And so those two users were then able to connect, and the person who had been looking for support was able to find support.
Yeah, as Saad has mentioned, really the major way this helps patients is it helps to amplify our message. One of the things that we're really passionate about, both Saad and I, as well as the department at Cincinnati Children's, is providing the best care possible for children. And we realize that we're not going to be the ones caring for all of the children in this country. And so what we can do to provide better care for all those children is help to educate all the providers who will be caring for children. And so that the type of information that we're sharing allows other people to be better informed, to learn a little bit more, that they can hopefully use to deliver higher quality care. And so in that sense, it helps hopefully to improve care patients receive. But as far as the direct benefit, I guess it can be hard to measure. Related to research, we have had several social media posts, so not just on Instagram, but we've had several blog articles, for example, that have focused on our research trials. We've used some of these posts to try to recruit patients, as well as to describe our research. And when we're creating these blog posts, what we're really trying to do is describe the value of the research for your children. As a parent, how this study can improve the care that your child receives or the care your child will receive in the future. And try always to bring our research back to that real base level. How does what we're doing help you or help someone in the future?
The next step for our social media platform is to, first of all, make sure that we are being consistent in what we're already doing and making sure that we're going to continue putting out the same high quality content that we have always been putting out. We think it's very important to be consistent and to provide the consumers of our content the content that they are expecting. On top of that, I think that we're we have a very open mind to being to looking for the next new technology or the next new wrinkle to any social media platform that could help us do a better job of putting our message out there, improving our educational offerings, and just helping patients and clinicians the way that we already have been doing in a greater capacity.
Yeah, I agree with what Saad just said. I think our biggest challenge is maintaining what we've created. And our biggest opportunity is continuing to innovate. And so we're always looking for the next new platform that makes sense for us. We're also looking for new ways to use our current platforms. And fortunately or unfortunately, those platforms are constantly changing. Platforms like Twitter are constantly making changes, adding or increasing character limits. A platform like Figure One is allowing us to add links to our posts. And so figuring out how we can use these new tools to better deliver our message and even deliver new messages. On our blog, we're always looking for new ways to add technology, whether it's adding new video content or new styles of video content like 3D video, adding new applications or embedding new applications. It's really trying to find a way to engage people, and I'm saying people very general. It's a way to engage people at all walks of life, whether it's families, parents, patients, or providers, whether it's radiologists, nurses, technologists, or people completely outside who are just interested in medicine, how to engage them with the content we're creating and hopefully teach them at the same time.